Hello. Myself is Pakthuria. I am a student of second year BPT from the Marwad University, and today's my topic is equilibrium test from the subject exercise therapy 2. Here we will see the equilibrium test. What is equilibrium? The balance and the stability in the body, which is called equilibrium. Criteria for the posture, movement, and the fall prevention. And the physiotherapist assess equilibrium to guide the rehabilitation. The importance of the equilibrium testing, the first will be the detect the balance disorder. If if there is any balance disorder in the patient, we can test by checking the equilibrium test, assess the fall risk, guide the treatment in the neurological, vestibular, and orthopedic conditions, evaluate the rehab programs. The type of equilibrium test. There are mainly two types: static equilibrium and dynamic equilibrium. First, what is static? Static means the maintaining the balance when stationary. Example: standing. The second is the dynamic equilibrium. What is dynamic equilibrium? The maintaining the balance during movement. Example: walking. Here we have a small difference of the static and the dynamic. First, in the static, the all the particles here and the first all the particles are at the rest and there is no motion between the reactants and the product. And the dynamic, the changes occur within the mixture, keeping the total composition the same. And in the static, second difference is the both forward and backward reaction have come to halt. And in the dynamic, the rate of forward reaction is equal to the backward reaction. The third is the dynamic equilibrium does not resemble the exit situation in taking place in the system. And the third, the static equilibrium will represent the exit situation in the mixture. Fourth will be the dynamic equilibrium is more often discussed within the chemical content. Fourth is the static equilibrium is often applied in the mechanical chemical content. Okay, so next, what is static? We will study the static equilibrium in deep. For the static equilibrium test, we have mainly three type of test which we can use to diagnose the equilibrium of the patient. First is the Romberg test, in which the stand with the feet together, eyes open, then close. Positive if away, increase the eyes closed. Stand feet together. Here the first photo. This photo represent the Romberg test. Then the second is the single leg stance test. Time, this the time how long patient can stand on one leg. This is the photo of the single leg stance test. Now the tendon test, heel to toe standing balance, and this is the heel to toe standing balance. Now we will study the dynamic equilibrium test. There are three mainly. The first is the tendon walking. Walk in a straight line, heel to toe. Second is the Fukuda stepping test. March in the place with the eyes closed for 50 steps. For the 50th step, we have to close the patient side, rotate or displacement. This is the vestibular issues. Third is the Berg balance scale. 14 items scales measuring balance during the everyday task. We will give this to the patient. Now the clinical tools and the scales. The first for the equilibrium test is the Berg balance scale. Time ups and go, TUG test, dynamic gait index, the functional reach test. Now the interpretation of the result, how we can interpret the result of the equilibrium. Compare with the normal values. We will compare the patient with the normal, how the patient is normally walking, and how the affected patient is walking. And second, identify the risk of fall, the many risks, how the patient is falling. Third is the trailer invention to improve the balance. Application in the rehabilitation, how we can apply the equilibrium test in this physiotherapy field. The first, in the patient, in those patients we can use the equilibrium test. First will be the stroke patient, the Parkinson disease. The patient who is suffering from the Parkinson disease mainly have the coordination and the balance impairment. And the vestibular disorder patients, the elderly fall prevention programs. In this all types of patients we have to do the equilibrium test. And the conclusion for the equilibrium test, the equilibrium testing is essential for the patient safety and recovery. The accurate assess help in the personalized therapy planning, combine the multiple tests for comprehensive evaluation. Thank you.